Hello and welcome to this Mental Health Trent Talk special. I'm James Lure and I'm alongside Alex Tracy today. It is Mental Health Day. We have 5 live guests in association with Mental Health Awareness Week. We are feeling good all this week with Fly.
All this week, feel good with Fly.
Clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Clap along if you know what happiness is to you.
You've heard the feel-good songs, we've spoken to the Student Union Committee. Now today it's University Mental Health and Wellbeing Day. This is all part of Mental Health Awareness Week and part of Feel Good with Fly Week. Now I'm joined by Paul Dodsley, who is our Student Health Development Coordinator. Hi Paul. So briefly tell us, mental health, it's a big issue, but not many people like to talk about it.
No, there's quite a lot of stigma attached to mental health, and we know that 1 in 4 people will experience having mental health and 1 in 6 will have a mental health problem. And I think it's good to conceptualise the main strategy for mental health, which is no health without mental health, which kind of says a lot. And we all have different periods in our life where we feel a little bit stressed and kind of we cope with it, and then we're stressed at work, and you know it's general day-to-day life, and a little bit of stress is good for us, but when it becomes more long-term then the issues start to come on where it can affect us kind of more long-term basically. And I think the best thing is really to, when you have got problems, to admit you've got a problem before you can get better and then take action basically.
You've got quite a big role here at the university, Student Health Development Coordinator. Just briefly explain what that role involves and what work you do with mental health.
Mixed and varied really. It's kind of concentrating all the main themes. We know with students there's big issues around alcohol, sexual health and mental health, and the other issues around public health and meningitis and smoking, and generally just looking after yourself, because we want students to come into university feeling well, they study well, and then when they leave university they're well as well. So it's kind of, you know, providing those opportunities where they can access services where, you know, that helps them to become well. With mental health it's really important because it's one of the biggest issues. It's one of the biggest issues in Nottingham, not just for university students. So it's just letting students know where they can go to get support, but also it's like the self-medication as well, that you don't have to always go to your doctor to get medication. It's kind of do a little bit of exercise, you know, talk to friends, become more connected and learn a little bit, keep your mind active and whatnot.
And finally, as you said, you mentioned there's quite a lot of services available. For students that are watching this or listening to this thinking, I think I've got mental health problems, or they've had some symptoms, had some issues, what should they do first and where is best to go for advice?
Yeah, I suppose what you've said earlier is kind of identifying whether they have got a problem. And even if they're a little bit unsure, then come along to Student Support Services or Student Support Centre just to chat to somebody. Just say, look, I've got a bit of an issue with something, I need to chat to somebody. And, you know, they'll get an appointment more or less straight away. There's other services, the eating disorder service, there's all the wellbeing issues. There's a vast array of information online as well. So if you've gone to NTU website and just put in counselling or wellbeing, all the information will come up there. And it'll give you contacts of where you can get further support from.
Okay, great. Thank you, Paul. So if you want any more information, you can go to our website, flyfm.co.uk, click on news, then click on Trent Talk.